Heart failure is mainly because of decreased pumping capacity of the heart, which might be due to any reason like previous heart strokes or some viral infection of heart muscle. So overall, these patients will have reduced pumping capacity of the heart that leads to limitation of their quality of life, and also certain symptoms like shortness of breath while walking and swelling of feet. We recommend salt restriction for all these patients to prevent fluid accumulation and salt accumulation in the body, which is a major consequence of heart failure and which is a major cause for aggravation of symptoms. So salt restriction has to be strictly followed, and usually we say no added salt or less than 2.5 grams of salt for every patient. Along with that, regular physical activities should be performed. That only keeps them conditioned for physical activity. And always we recommend physical activity which is tolerable for them. For all these patients, it is always better to do some meditation to come out of mental agony this problem creates. Meditation provides a soothing effect. They have to keep a watch on their weight. It is very important to measure their weight periodically. So can be once in a day. So whenever there is a sustained increase in weight, it is always better consult doctor. Usual weight increase is because of fluid retention, and this fluid retention is the cause for precipitation of heart failure. So any weight gain has to be reported to their medical care professional, and that should end up in an action to reduce it. With this care, patients can have a better quality of life and less chances of decompensation and less chances of hospitalizations. And also periodic checkups as recommended are very important, since we may end up in escalating therapy as and when needed in these patients.